Imagine your blood, a lifeline teeming with healthy cells, suddenly under siege. This is the microscopic invasion of leukemia, where cancerous cells begin to overtake the healthy ones. Your blood is under attack. Leukemia, a cancer that starts in your bone marrow, creates rogue blood cells that crowd out the healthy ones. But here's what you need to know. Survival rates have tripled in recent decades. Let's break down what causes it, how to reduce your risk, and the revolutionary treatment saving lives. Causes of leukemia. Leukemia isn't one disease, it comes in 4 main types with different causes. Leukemia can be broadly classified into 2 main types, acute and chronic. Acute leukemia is fast-growing and requires immediate treatment, while chronic leukemia progresses more slowly and may not need treatment right away. Additionally, leukemia can be categorized based on the type of blood cells affected. Lymphocytic leukemias, like ALL and CLL, affect lymphocytes, whereas myeloid leukemias, such as AML and CML, impact myeloid cells. Several factors are known to increase the risk of developing leukemia. Exposure to high levels of radiation, such as those from nuclear accidents or certain medical treatments, is one such factor. Chemical exposure, particularly to benzene in industrial settings, also raises the risk. Genetic disorders like Down syndrome can increase susceptibility. Certain viruses, such as HTLV-1, can trigger adult T-cell leukemia. Lastly, a family history of leukemia can indicate some inherited predispositions. All leukemias begin with DNA damage in blood stem cells. This damage creates immortal cells that continue to multiply uncontrollably, leading to the development of leukemia. While we can't prevent all cases, these strategies lower your risk. Limit radiation exposure, like having medical scans only when necessary. Handle chemicals safely, such as benzene and formaldehyde. And importantly, no smoking, as it's linked to an increased risk of acute myeloid leukemia. Regular blood tests can help, especially if there are unexplained high or low counts. Be vigilant for symptoms like frequent infections, easy bruising or bleeding, bone pain, and extreme fatigue. Childhood ALL, which is the most common cancer in kids, has unknown causes. But with treatment, survival rates now exceed 90%. Leukemia treatment has undergone a miracle transformation. The standard treatments for leukemia include chemotherapy, which is the first line for most types. Radiation is targeted to the bone marrow. Stem cell transplant helps reboot the blood system. And targeted drugs like Gleevec for CML offer more precise treatment options. In recent years, we've seen some truly remarkable advancements in leukemia treatment. One such innovation is CAR T-cell therapy. This technique trains the body's own immune cells to hunt down and destroy cancer cells. Another promising approach is immunotherapy, which boosts the body's natural defenses to fight the disease more effectively. And then, there are bispecific antibodies like Blincyto, which have shown great potential in treating acute lymphoblastic leukemia. These therapies, well, they represent a new frontier in our battle against leukemia. When we look at survival rates, there's some encouraging news. For childhood acute lymphoblastic leukemia, the 5-year survival rate is over 90%. Chronic myeloid leukemia shows a 70% survival rate at 10 years thanks to Gleevec. And for adults with acute myeloid leukemia, new treatments are doubling remission rates. It's quite remarkable, isn't it? Let me introduce you to Sarah. CAR T therapy put her acute myeloid leukemia in remission after 3 relapses. Her story is truly inspiring. You know, leukemia isn't the death sentence it once was. If you're fighting it now, there's never been more hope. Please share this video to spread awareness. And remember, unexplained fatigue or bruises deserve a blood check. It's important to stay informed. Know the signs. Check out our free symptom checklist. It's always better to be safe and informed.